All right, are you ready to rock?
Let's do it.
Okay, three, two, one. Well, hello, my friends. Thank you for joining me today. You have a lot of choices on the web, but you chose to be with me today. And I'm having a conversation with Nancy Noel, who is a dental hygienist. And you know my insistence on having teeth that are tight, white, and bright. And you've heard me say this in the past, that your smile is the key that unlocks doors of opportunity. So welcome, Nancy Noel.
Hi. Thanks for having me today.
Yeah, absolutely.
I'm really excited to be joining you today to talk about this because this is a subject that really I feel very passionate about.
Yeah, and it's so important. I think there's this opinion amongst many people where they might say, well, if somebody doesn't like me for who I am, I don't want to be fake. And they think that having white teeth and positive dental hygiene is the same thing as getting various augmentations and such. And it's got nothing to do with that. We are going to talk about the cosmetic, the aesthetic aspect, but oral health, dental health is closely connected to our general health as well, isn't it?
That's absolutely right. A lot of people understand really well that your gut health is really important to your longevity and your quality of life and your health. And having an inflamed gut is detrimental to all those things. Well, your gut starts right in your mouth. It's just one long tube. So if you're trying to have a healthy gut and a healthy body, but your mouth is a mess, you're really going to struggle to reach your health goals.
Yeah, I had heard that there are some oral infections that can actually affect a person's heart as well.
That's absolutely true. Yes. Yeah, having gum disease and oral disease is strongly associated with heart disease, liver disease, and even certain types of cancers.
And it's so preventable.
It really, really is. Yes, but just most people were never taught properly the right ways to do it.
Yeah. You know, a lot of people think that oral health is just brushing your teeth, brushing and flossing. Is it more than that?
Brushing and flossing are very important parts of it. And you can have a great healthy smile with just brushing and flossing, but the goal of your brushing and flossing isn't to just say, I've done my brushing and flossing. The goal is to remove that sticky bacterial film that builds up on the teeth. So whatever methods you use to do that, which for most of us is brushing and flossing, that's really the goal, is to remove that sticky, yucky, filmy goop that builds up on
Yeah.
your teeth over time. Have you ever had maybe the experience where one night you're just too tired or you forget to brush, and then when you wake up in the morning, it feels like your teeth are kind of slimy or have little fuzzy fur coats on them?
Yeah.
That's that bacterial film. It's called biofilm or plaque. You've probably heard the word plaque, but it's that
Yes.
stuff is very bad for you.
I remember in elementary school, there was a part of health class where they gave you these little red tablets to chew on.
Yes, the little disclosing tablets. Yes, they're little chalky pink stuff.
Yeah.
Yep,
What is
and
the
they would,
purpose?
ah,
What is the purpose of that?
so those little red tablets have a dye in them, and that colors the bacteria pink. So after you chew up that little tablet or you swish with the red stuff, and then you look at your teeth, you're supposed to see all the little pink spots on your teeth where you didn't effectively brush all that bacteria away. So those little tablets, you can actually still get them. They're called Red Tab or Red Coat, and you can usually get them at a pharmacy. You may have to
Yeah, I
ask the
can still.
pharmacist. Hmm.
Yeah, yeah. They're. I remember they had a certain flavor too.
Kind
It
of,
ta-
yeah, they have kind of a weird chalky taste.
yeah. I mean, that takes me back decades. Decades. Now, I go twice a year for a clean, and they get in there and they scrape, they floss, and they polish, and
Hmm.
they look at the gums and the roof of my mouth and my tongue and all this kind of stuff.
Yes.
Tell me all the components of a dental exam.
Wow, that's a great question. So we always want to check all the hard and soft tissues for any little lumps and bumps that look like they don't belong. That's part of an oral cancer screening. we do for all of our adult patients. If you go to a dental office and they're not doing a cancer screening, they are shortchanging you, and you should absolutely have them take a look. There are a lot of anatomical features of the mouth that are within normal range, but the first time you look in there and you really get in there and look in the mirror, you might think, oh my gosh, this is terrible. And chances are it's probably normal. But there can be some oral cancers, even for people who are not really considered high risk. If you don't smoke and you don't consume any alcohol, those are two big risk factors for oral cancers. But even people who don't have those risk factors can still get them. When I was in school, one of my dental hygiene instructors developed an oral cancer, and she had never done any of those high risk activities. So you should be checked every time. So that's part of the exam. Also, we check the gums to see what's called the periodontal attachment. And so if you've ever had your hygienist probe and call out numbers to the assistant, 323, 323, that's a way of assessing the gums and the underlying bone. Gum disease destroys bone. So you want to have healthy jawbones. Otherwise, you get all kinds of bacteria down in those pockets. And of course, the dentist also examines the teeth. They usually do it radiographically with x-ray pictures, as well as just looking directly to see if there are any weak spots or other things like that.
I noticed that the technology has changed over the years.
Oh my gosh.
I don't see the films anymore. They're not taking the films. It's like they just put this thing in your mouth, they take a picture, and then it shows up on a computer screen, 2 feet to your right.
Yes.
That has changed.
The X-ray technology is so much better now. You get far less radiation to have the X-ray picture taken, and we get much more accurate images. So yeah, the X-ray technology has changed a lot. It's much, much better now.
And then I noticed every few years they do this thing where you put your chin on this thing and this machine kind of goes.
Oh, the one that goes all the way around
you. Yeah. What is that all about? What's that?
That is a different kind of X-ray picture. It's called a panoramic. And the image kind of looks like all of your teeth on one big picture. And it's used a lot for, well, in teenagers and very young adults. It's a good way to look for wisdom teeth. But also, it's good to update that every couple of years, because sometimes there are abnormalities that can show up radiographically that you just can't see any other way. I had one patient where it turns out he had calcifications in his parotid arteries, and he ended up needing surgery to clean that out because he was just getting set to have a stroke but we could see it on the radiograph.
Wow. Let's talk about timelines.
Okay.
What are the timelines in a person's life? I know here I am at 60 years old. I have all my teeth, I have a bridge and a cap, some cavities, that kind of thing, that have been there for a long time. What are the stages of a person's life where their mouth changes, where their teeth change? I mean, I find that, I remember years ago I heard someone say, it was like a funny line that said, only brush the teeth that you want to keep, or ignore your teeth and they'll go away. That one always made me laugh.
That's true. Well, obviously in early childhood, there's lots of change. A baby's born with no teeth, and then they start getting their baby teeth coming in, and usually around age 2, they've got all their baby teeth. And then around 6 or 7, they start the process of losing those baby teeth and getting their permanent adult teeth coming in. And that's usually done around age 12 or 13. And then, those teeth have got to last you the rest of your life. So in terms of stages, how things change, in terms of your lifespan and the timeline of how your health will change and your oral health will change, for women, pregnancy is a big factor. A lot of women start to develop dental problems in association with pregnancy, and it's thought to be related to some of those hormonal changes that happen. For adults, there are a lot of different factors, and I really can't say it's directly age related. It's more related to other factors. Obviously, trauma, if you're in an accident or you get hit in the face and break a tooth, and the longer you live, the more likely you are to get trauma. So but it's not really directly an age-related thing.
Okay.
Smoking is a risk factor for a lot of oral problems. So if you're a smoker, you just want to really stay on top of your good oral hygiene. Of course, diet and overall health can have oral manifestations as well. So you just got to take care of them.
Mm-hmm. A lot of my subscribers are pipe and cigar smokers.
Mm-hmm.
Quite a few, as a matter of fact. And for the guys that are pipe smokers and cigar smokers, I would call them like weekend warriors. They're not the
they're not like pack-a-day cigarette guys.
Yeah, like cigarette people will like, oh, I need to go out and have a quick smoke. No one ever says I need to go out and have a quick cigar or a quick pipe. Those are reserved for when you have an hour, to sit there and just relax. And many pipe and cigar smokers don't consider themselves smokers, and it almost like angers them when medical professionals say, "Do you smoke?" And they say, "Well, just an occasional cigar or pipe," and then they get written down as a smoker. I think for the occasional weekend warrior, the guy who has a cigar on the golf course or while he's out in his workshop, or the guy who sits down and smokes a pipe while he's reading, he's not the one after another cigarette guy. They tend to be a little bit more mindful of their oral hygiene, but talk to the pipe and cigar guys. Me being one of them.
All right, so a couple of things about the pipe. One is if you're a pipe smoker and you always hold your pipe in the same position and you kind of chomp down on it, over time it can wear your teeth a little bit. And I don't know if you've ever seen this, but sometimes you get sort of a little groove in the teeth where the pipe sits. So just be mindful of that you don't want to just clench it in your teeth and walk around,
like
with your
Popeye.
pipe. Right. Because over time you can actually create damage to the teeth in the shape of that pipe stem where you're holding it in your teeth. So that's, just be mindful of that. And the other issue for pipe and cigar smokers is stain. That's a huge one. And especially if you've got a lot of existing dental work, fillings, crowns, bridges, that kind of thing. Usually those, right at the edge of those, it's called the margin. It's like right where the filling and the tooth interface.
Yes.
That little seam is going to want to pick up a lot of stain. So dealing with dental stain is a huge part of what I do. Everybody wants to have shiny, bright white teeth. And if they happen to be healthier in the process, then that's great. But let's face it, most of us are motivated by vanity, and there's nothing wrong with that.
Yeah. There have been some archaeological digs where they found guys in the skulls in the 1700s, where they had literally a half moon groove in their teeth because pipes were made out of clay and they're very abrasive. And if you're clenching on a clay pipe, it's like clenching on sandpaper or a file. And I think that's called, in the archaeological world, they call that a pipe notch. Because there were a guy, like a sea captain, would just always have that pipe. And, and you're right about just creating that groove that physically changes the look of your teeth.
Yes.
Yeah. What about pipe and cigars and gums and the harder tissue? Is there something that should we be swishing our mouth out? Should we be, should we be brushing our teeth right after a cigar or pipe, or help us with that?
So these are good questions. I would say probably the overall thing to keep in mind is that any kind of smoking, pipe, cigar, recreational substances, whatever it is, it has a very drying effect. A lot of people get a real dry mouth. And so a dry mouth generally leads to more stain depositing on the teeth, and it increases risk of decay and gum disease. So just a quick swish with water can be helpful right after you smoke. If you don't have time to do a full-on brush floss routine, just a good quick swish with water is helpful. There's another practice that a lot of people like to do. It's called oil pulling. Are you familiar with it?
I was actually going to ask you about oil pulling. I know some people that do that while they're getting ready for work in the morning, or while, some gals that while they're doing their hair or makeup, they're doing their oil pulling. Tell us about that.
So oil pulling is a really ancient practice. Supposedly it comes from India. I haven't done the research to know if that's really true, but it's a very old practice. So the way I do it and the way I recommend it to my patients is you take a little scoop of, I like to use coconut oil, but you don't have to use coconut oil. You can use any really good quality food grade oil, something that you wouldn't mind ingesting or putting on your skin. And you just take a little bit of that oil and you put it in your mouth and you swish it around for 10, 15 minutes. And it's not just a lazy swish. You're not just, you're really going to work it between the teeth. And then when you're done, you just spit it out. Don't spit it in your sink because it'll clog up your drain. So spit it in a paper towel or in the garbage, or go outside and spit it in the grass. But this is really good because it moisturizes that tissue and it keeps the surface of the teeth a little bit lubricated so that the sticky bacteria are less likely to stick. The stain is less likely to deposit on the teeth. So oil pulling is a great practice. And if you like, you can add in a drop or two of essential oil. If you want it to taste like peppermint or cinnamon or something, you can do that. So one rookie mistake for oil pulling, ask me how I know, is using way too much oil. So I would say if you're going to use coconut oil, you start with maybe a scant teaspoon, just a little bit, because if you keep it in there swishing for 10 or 15 minutes, you're going to work up a lot of saliva, and that's going to get really uncomfortable if you have too much in there.
Yeah. So that's a good tip for my pipe and cigar guys, too.
Definitely.
I would imagine.
At the drugstore also, there are a lot of dry mouth products, rinses and sprays and lozenges and stuff, and they all work. They're all good. So in general, I'm in favor of using those, especially for people who tend to have habits that contribute more to the dry mouth.
Yeah.
There's a product called xylitol, Xylitol. It's a sugar alcohol, and it's used as a sweetener in a lot of dental products. And xylitol is actually a great product for oral health. And there are a lot of companies make xylitol products. The brand I like best is called Clear. It's spelled with an X, Xlear, and they've got lozenges and candies and gum and rinses, and you can get it on Amazon. It's a great product. Really good for dry mouth.
So dry mouth would be, that's one of the issues when I teach, I've been teaching acting and modeling students for a long time, just like a little side gig.
Nice.
When I stopped doing actually the acting and modeling many years ago, I started teaching. And one of the things that I was teaching people was, before you do a monologue, before the director, says 3, 2, 1, action, you don't want to be having the mint in your mouth, because mint will dry out your mouth. And I remember reading many years ago that slippery elm is really good for lubricating the inside of the mouth, and that mint, like, don't have an Altoid type product before you have to speak. If you're giving a speech somewhere, if you're being on camera, a lot of people will put mints in their mouth, thinking that's going to give them a lubricated mouth that's going to work with the soft tissue, but it actually dries it out. So I've heard things like, have like a cough drop or something like that, or a slippery elm thing. They used to call slippery elm lozenges are an opera singer's best friend, because it literally lubricates all the soft tissue, and it's a product from the 1800s. I bet you didn't know that, did you?
I didn't. So I've heard of slippery elm. I've not seen it used in any commercially available dental products, but anything that works.
Yeah. Let's talk about aesthetics.
Okay.
I like to say that your smile is the key that unlocks doors of opportunity.
Oh, that's a great saying. Yes, I wholeheartedly agree.
And my opinion is that you need to enter smiling everywhere. Like, everybody does this serious look, kind of like it's the Ben Stiller Zoolander kind of, the blue steel, the Magnum look. And I say, now just lighten up and let people see your smile. And they used to say that people have 6 people size you up in 6 seconds. I say they size you up in 1 to 2 seconds. And one of the best ways to have a positive impression on people is just to enter smiling, no matter where you go. Just be a person who smiles. It's inviting. I believe
Yes.
it does open up doors.
Makes you more approachable for sure.
100%. I mean, whether it be job hunting or dating, meeting somebody for the first time, if someone's looking for love or re-looking for love after divorce, a lot of times people feel like they don't have a lot to smile about, and I say, no, you do. Like, let's show those teeth, because my
Yes.
thing is this. I like to say that a smile without teeth is nothing but a smirk. And what do we think about people who are smirking? They're up to something. They're suspicious. But a smile is open. It's inviting. Like you said, it gives people a green light to approach you. So in one sense, it's a smiling person walking into a bar or a club is approachable. You want to be around them. They're happy. I want to be around happy people. I don't want to be around serious, grumpy people. Let's talk about white teeth. Let's talk about bright teeth. Let's talk about white strips. That seems to be a thing that went from dental offices to consumer level. It's on every shelf in every pharmacy, every department store are white strips. Tell us about white strips. Are they good? Do they work?
All right. So white strips are great. They do work. There are a bunch of different brands available, and they all work. They all have their basic active ingredient is hydrogen peroxide.
Mm-hmm.
And the way the strips work is if you imagine it, it's kind of a little bit sticky, like almost like a Band-Aid, right? It's got that sticky, but not, it's not like Gorilla Glue sticky. It's like sticky note sticky. And the gel is loaded onto the strip, and you kind of just put it on there and you fold it on and you leave it on. Usually it depends on the instructions. Some of them say leave it an hour, some of them say half an hour, some say 20 minutes. So just go by whatever the instructions say. And yeah, they work great. So they do have a couple of limitations. If your teeth are really crowded and overlapping, you're going to have trouble getting that strip to conform to the shape of your teeth. Like there's going to be gaps. Does that make sense?
So there has to be contact.
You want it to directly contact the surface of the tooth. Okay. Yes. You got to be careful also with the strips. Yeah, you want to really push it on, but you want to be careful that you don't get it on the gums. So you want to make sure the strip is not touching your gums, because the gel, it can be real irritating to the gums, and you can get kind of a sore, angry spot.
Yeah.
So yeah, when you put it on, you want to really squish it onto the surface.
What about the trays? I've seen those trays. I've seen everything from, and they look like the sports.
Yes.
The things
like the athletic guard.
Like, where you heat them up in hot water, you soften it, and then you put your impression in it. Then apparently you put the gel in it or something, and then you put the piece or the tray in. Tell us about those.
So the tray systems that are over the counter, I'm not a fan. I don't feel like they give an optimal result, and there's a lot of steps. You have to put the tray in the water and then bite on it, and I'm just not a fan. If you want to do a tray system, I would say go to your dentist and have it professionally done, because they have methods of creating the tray that really make it optimal for this kind of thing. So in the e-course that I wrote, I actually have a huge section about whitening and all the options that are available, but I will just say that the strips work great, and there are a lot of different brands. I am a brand ambassador for a brand called Burst, and they make a really good white strip. So if you're interested, I can send you my Burst code. You can get it for a discount, but I think it's about $15 or something for the set of strips. It's not very expensive, and it works really well. But you can just go to the drugstore and get them from Crest or Colgate or the store brand or whatever, and they all work.
Well, we'll put your link down below. That'll be good.
Perfect.
Shades of white, or teeth shades. I mean, we've seen those little cards with the different shades, and or the if you're getting a bridge or a cap or something like that.
They use the shade guide.
Yeah. How do you know when you've reached your whitest white? I mean, there are some teeth that are just not going to get as, I mean, I'm just thinking about like this box. I mean, this is white. This, like, my teeth are not this white. My teeth are more ivory white. They're not,
Hmm.
can I get my teeth whiter than they currently are? Or do some people just have a natural shade that's
We've
not going to get
all
better?
we've all got a natural shade. Teeth generally fall into either sort of grayish or sort of yellowish, and that's just how we're made. And so on those scales, you can move up a number of shades doing whitening, but ultimately there is an upper limit. And unfortunately, I think a lot of people have an unrealistic expectation
Hmm.
of what white teeth should look like, because teeth that are pure white, like the sheet of paper that comes out of your printer,
Yeah.
that looks very unnatural. It's kind of jarring to see it, and it looks very fake. And but people, I think, are just conditioned to see that because that's what's in the magazines and that's what's on billboards and stuff. But
Yeah.
all those images are photoshopped.
Okay. Yeah.
Yes. So having teeth that are healthy, and you can use the whitening products to lift it a couple of shades, but if your teeth are healthy and your gums are healthy and you've tried a whitening product and it's lifted a little bit, that might just be the best it can be for you. And it's probably really good. But it's no, you're not going to get your teeth white, white, white unless you want to just get, veneers or crowns on them. And that's
Yeah.
a big investment.
It is. What is the upper end of how much all that can cost?
Wow, that's a great question. So the white strips, the burst white strips, you can get for less than $20. If you want to go even cheaper than that, you can just get a bottle of hydrogen peroxide from the drugstore and swish with it. It tastes kind of terrible, but it's really good for lifting stain, and some people get a nice result with that. And it's what, $2 or $3 for the little hydrogen peroxide bottle, but
Yeah.
it's not going to hurt you to try it. All the way up to there's one called Zoom that's
I've heard,
done in the dental office,
yes.
and it's the assistant will apply the gel to your teeth, and there's a special light that activates the gel. So it takes a total of about 60 to 90 minutes of chair time, and it works really, really well, but it can be pretty expensive. It can be in the several hundreds of dollars to do that. But that's a really great option if, like today is Monday and you say, oh my gosh, I'm going to be in a wedding on Saturday. I want to get this done right away and I want an instant result. That would be the way to go. But if you're not in a rush, these other methods work very well, and they're more gradual.
Will one round of white strips get you to your optimal shade?
Wow, that's a good question. It's very case dependent. I would say most of the time, yes. Some people may need another round or two, and that, it happens, but you can just keep at it. One side effect that happens with the whitening, no matter what method of whitening you're using, is the teeth can get really, really sensitive to cold. So you want to
Mm,
pace yourself. You
mhm.
don't want to use them so much that then you can't eat or drink anything.
Yeah.
And that's a transient effect. It goes away pretty quickly, but if you
Yeah.
overdo it, you can be a little uncomfortable for a couple of days.
Let's talk about toothbrushes. I remember picking out toothbrushes that you could probably strip furniture with, and
Oh, those
then
really hard bristles.
thinking that the harder the bristle, the more like the more effective it's going to be. And then I started reading, go with the soft, go with the soft.
Yes.
What say you?
So soft bristle is definitely the way to go. And so, don't know if you can see my screen pretty well, but you want to imagine, like, if this is the surface of the tooth
Hmm.
and this is the bristle, it's that tip of the bristle that's doing the job. So you want to press it so the tip of the bristle is kind of in the gum line a little bit in gentle
Yeah.
circles. But if you press real hard, what's going to happen is that bristle will curve, and then that active part of the bristle is no longer in contact.
Ah,
So you want to make sure it's the tip of that soft, gentle bristle that goes in.
yeah.
Because if you scrub really aggressively, or if you're using a really stiff bristle brush,
Yeah.
you can really damage your gums. You
Yeah.
can make them bleed or be really sore. So I don't recommend that. The stiff bristle brush is really good for cleaning the grout around your toilet, but
Yeah.
not for your teeth.
What about electric toothbrushes? I started using, well, years ago, there was the brushes that actually spin.
Yes.
I think they actually call them a spin brush.
Mm-hmm.
I think. And then there was the kind of like the ultrasonic where you don't actually see it move unless it,
Yes.
like in the
But you
commercial.
feel those sonic actions.
Yeah,
Yes.
yeah, and those seem like they work really well. I feel that, like when I feel my teeth with my tongue, I feel after using that, I don't feel like I had a sander or a grinder on my teeth. I just feel like it really, really cleans. Do I? What is the mistake? Let me ask. What is the mistake that people make with electric toothbrushes? Are there any mistakes?
Oh gosh, there's 100 mistakes. I would say most people rush through it. And this is true no matter what method of brushing that you do. But most of the time, most people will brush their teeth, but their mind is on everything else. So
Oh,
you've got the brush in there, but you're thinking, ooh, did I mail the mortgage payment? And
yeah,
what's on the grocery list for tonight? And you're kind of thinking of everything except the task at hand, which is cleaning your teeth.
yes,
So another issue with the electric brushes, well, this is not really an issue with the brush, but with the user, a lot of them have a timer. They have a little 2-minute timer, and that helps
mhm,
you kind of time yourself, make sure you're brushing long enough. But most people whiz through it. I can't tell you how many times I've had patients in my chair and they say, oh, yes, I got the new electric brush and it's so great. And I said, oh, okay, what do you think of the timer? And they're like, timer? What timer? So they haven't used it long enough to get to where it makes that little extra pulsing that tells
right,
you it's been 2 minutes.
right,
So you want to make sure you're brushing for long enough. You want to get all the surfaces. So you want to get on the outside, you want to get on the inside, you want to get on that chewing surface, the occlusal surface, and behind even the last tooth in each arch. That's a trouble spot for a lot of people.
hmm,
And here's a little tip, whether electric brush, manual brush, a lot of people have a challenge with the bottom front teeth on the inside. A
yeah,
lot of people get a lot of plaque and tartar buildup there.
yeah,
So what you can do is when you're brushing, the pen is not toothbrush, but if you turn that brush straight up and down,
yeah,
and you can kind of get that tip right down in there and you kind of bounce it up and down,
yeah.
that's a really good way to get in there. So it's going to splatter up your bathroom mirror. So, get a little can of those Windex wipes to keep it clean, but you'll feel the difference when you start doing that. You can do it for the upper and the lower. Just
Okay.
turn that brush vertical to get the bristles up there.
Do you recommend flossing after brushing or
Oh
before?
boy. I am not a purist. Personally, I usually do it before.
Hmm.
But if you're doing it at all, I'm good.
Hmm.
There's, I think scholarly arguments could be made to defend either position. So I'm not picky.
I know my flossing game improved when Glide floss came out, and I forget what the type of string that is, but that just
Hmm.
gets in between my teeth so wonderfully. And I remember it was like the old floss was either waxed or unwaxed, and my teeth were so tight at one time where floss would break off, and then I'd have a
Oh,
piece of
oh, a
floss,
little fiber stuck in there. I hate that.
and I hate that. And then this Glide came out, and that is just like game changer.
So Glide is a good product. If your teeth are so tight that you just can't floss otherwise, then go for the Glide.
Hmm.
It's not my favorite product though,
Oh,
because you want a product that's got enough texture to it to really grab the plaque
oh,
when
okay.
you go between.
Yeah,
So you know what? If you're one of those people where you just can't floss any other way, go for it.
yeah,
But if you can floss using a different product, I would recommend that because you want something that's got some what's the word? Some grippiness to it.
yeah,
I don't think grippiness is a word, but
yeah.
it'll grab the plaque better.
Okay, so here's a question then.
Okay.
A little container of floss,
Yeah.
the reel of floss,
Mm-hmm.
versus the little self-contained little disposable placker kind of things.
Mm-hmm.
What do you think is better?
The old-fashioned way, with the reel. But again, for some people, if all they can use are those little floss picks,
Yeah.
then use that.
Okay.
It's definitely better than not flossing at all. The thing about flossing is you want to not just bring the floss between the teeth,
Yeah.
But then you want to kind of curve it against the side of the tooth and kind of rub under the gum line. Does that make
Okay.
sense?
Yes.
So it's harder to adapt the floss if it's just a little shorty on a floss pick to adapt that to go under the gum line that way.
I see. Am
But
I just am I just popping that up in between, or am I actually doing that sawing motion? Should I be doing that, or just pop, pop, go to the next tooth, pop it, pop it? Would
the the real purpose of flossing is to get, there's a little crevice where your toothbrush can't reach, like sort of between the teeth. And if you pop the floss through and then you curve it against the side of the tooth and then pull it up under the gum line, it's that
yeah?
lateral pressure against the tooth
Okay.
that disrupts that plaque, that biofilm that's there.
Okay.
So you don't really have to saw it back and forth. You know, if you want to, you knock yourself out. But the real trick to it is going under the gum line. So you're going to kind of curve it and under the gum line, and then you go to the next tooth, and you can even do that behind the last tooth in the arch to clean back there as well.
You know what? I've never done that. I'm going to do that tonight.
Yeah.
Water picks,
Okay.
irrigation things. Tell me about those. My dentist said I would benefit from a water pick.
So you mentioned that you have a bridge.
Mm-hmm.
Are you able to floss under the bridge?
I have a thing where I thread it through. And
Okay.
Then, yeah.
So that's good to use. So water pick is really good for people who have bridge work, if you are wearing orthodontic braces,
Yeah.
if you've got a lot of dental implants, the water pick's pretty good for that. But for the average person, I don't use one personally. They're not bad. If you have one and you like it, by all means use it. There's no downside to using it.
Mm-hmm.
But for the average person, in my experience, they don't really need it. But I'll just say I do have some patients that have it, they love it, they use it every day, and they swear by it, and their gums
Yeah.
are beautiful. So, you know,
Yeah.
if you have it and you like it, go ahead. I I don't really recommend it for everybody unless you're wearing braces on your teeth,
Right.
or if you've had a lot of restorative work like bridge work.
Okay. All right.
So the challenge with the water pick is that it takes up a pretty big footprint on your counter. You know,
Yeah.
it's kind of a bulky appliance and it's pretty
Yeah.
messy to use it.
Yeah.
And they make one that is for the shower, but it's not as effective.
Right.
And so because it's kind of cumbersome and bulky, most people kind of give up. So basically you've just spent $100 for nothing.
Right.
So I wish I could give a more rousing endorsement. It's not a bad product. It's really not. It's just I don't know that for the average person that it's really worth the investment.
Okay. Let's talk about two other pieces of hardware. I see these things for sale, these tongue scrapers
Mm-hmm.
and these little in between the teeth brushes.
Mm-hmm.
Let's talk about the tongue scraper thing. What's up with that?
I love the tongue scraper. So getting back to my original premise is that basically when you're brushing your teeth or cleaning your teeth, you're trying to remove bacterial film,
Mm-hmm.
right? So about 80% of the bacterial population of the mouth lives on that dorsal surface of your tongue.
Mm.
And so you've probably seen people where they've got kind of a crusty yellow tongue, or it looks like they've got, and this goes back again to the dry mouth. People with dry
Yeah.
mouth tend to get more of that filmy stuff on their tongue. If you drink
Yeah.
a lot of coffee, if you drink a lot of red wine, if you're a smoker, if you just are dehydrated most of the time, which is like 95% of people. So I'm a big fan of the tongue scraper. However, you don't need to invest in one from the drugstore. Now, I happen to have a fancy one that's copper because I'm fancy and I like all the fancy oral things, but you really don't need that. You can just use a spoon. You can just use a disposable plastic spoon
Yeah.
and just use the edge of it kind of like a blade.
Yeah.
And what you do is this is going to look very glamorous, but you stick it out, you stick your tongue out, and you just put the spoon back as far as it can go comfortably. Don't gag yourself, and just gently kind of scrape from back to front. Do it in the shower because it's kind of gross. And you can rinse it off, and you can just keep your little special tongue spoon in the shower if you want. And just a couple of times a week, and just scrape it a couple of times until it runs clear, and you'll see all this goop come off your tongue and be like, ew, it's so gross. But yeah, tongue scraper, great product.
What about the little interdental brushes that you see?
I'm a big fan. I love them. Now, I'm currently going through a treatment called Invisalign. which is a way of moving teeth. So I have a little clear plastic tray. So my teeth are moving a lot. And every time I switch to a new set of trays, I get a new little spot that's more open than it was before, and it becomes a little food trap. So those little brushes are excellent for that. And they come in, there's a bunch of different manufacturers. They come in different sizes. If you go to the drugstore and look, you'll probably see 5 different brands, and they go from super skinny to really big fat ones. So you want a brush that is going to be basically the fattest one that will fit.
Yeah.
So they're great. They're really good for getting in those little spots. And I keep a bag in my car, and I keep a bag in my purse, and I keep them in my bathroom, and just like poke, poke, poke. They're really good. Also, they're very portable. So if you're out to lunch with friends, and you've got that one little annoying food trap, you can just kind of excuse yourself to the restroom and poke, 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 and you're good to go without having to do the full routine. Love those. So my advice for anyone who wants to try that, go to your drugstore, just buy 3 or 4 different ones and try them all and see which one you like, and then just keep using that one.
Okay.
Yeah.
That's going on my list. I've never tried them, but I think I'm going to now. You can.
Oh, I love them. If your teeth are real tight, you want to have the really skinny ones, the ones that say for tight contacts.
Okay.
And there's actually a brand, the one I use is by Gum, and they're called Soft Picks Advanced. Gum Soft Picks Advanced.
Okay.
And they're just like little plastic toothpicks with little rubbery things on the end, and they're disposable. I love them.
Okay. Let's talk about bad breath.
Oh boy.
That's a biggie. I know I had lamb on, when was it? Today is on Saturday night. I made a leg of lamb. I put a lot of garlic in it, covered it with rosemary.
And you didn't invite me to dinner.
I know. Well, next time. Let me tell you something. Literally 24 hours later, I was still tasting that garlic. And I brushed my teeth at least 2 or 3 times since then.
Well, garlic is a tough one because you absorb it in your body. And so it's actually coming out. You can smell it in your sweat. You're excreting it in all of your fluids. And so, garlic's a tough one. I love garlic too, but it's stinky.
Yeah. And all right, so that's like food breath.
Yes.
That's food breath. But there's a difference between food breath and bad breath.
Yes.
And I noticed today, that when I don't eat, I have worse breath.
Sorry, it's my dog barking at the mailman, I think. Mocha, hush. Sorry about that.
I find that I have worse breath when I don't eat than when I do eat. And of course, now that we're living in a mask culture, my breath was backing up on me today. I didn't eat breakfast, and I'm at work, and I'm like, what the heck? And I'm like, this is weird. And I brushed my teeth and flossed and everything.
Are you a low carb guy? Because if you're in ketosis,
I am.
A lot of people get kind of the stinky ketosis breath. So honestly, I would say just get a little bottle of peppermint essential oil, and you can put a drop or 2 in your mouth, and that helps a lot.
A lot of my followers are low carb, carnivore types. Holy cow!
Low carb is great, but it's called ketosis, right? When you're low carb adapted.
Yes. Yeah.
So a lot of people get kind of that funky ketosis breath. So just use. You want something that's not going to have a sweetener in it, right? Because you don't want to mess up your carb thing. So I would say just get a little bottle of peppermint essential oil. You can get it at a health food store. You can order them online. You just want to make sure it's one that's food grade. And you can just pop a drop or 2 of that in your mouth, and it helps a lot.
Great, because I do have a lot of people who are carnivore and keto,
low
carb, and
also you got to be careful too, again, with the dry mouth, because the dry mouth will contribute to that as well.
Okay.
So you got to keep it all lubricated.
Yeah.
Now, a big cause of bad breath can be if you have a sinus infection, or a lot of people get kind of a yeast overgrowth in their nasal cavity or their throat, and that can. So just make sure if you're otherwise healthy, chances are you'll be able to deal with the stinky breath pretty well. If you have teeth that are broken, a lot of people, I can't believe how many people walk around with teeth that are really broken or decayed or damaged, and they say, well, it doesn't hurt, but it's like a reservoir for all those bugs that cause disease and bad breath. So
Wow.
if you have outstanding dental work, get it done. If your gums are a mess, go see your hygienist, get it taken care of, because those are huge contributors to bad breath.
Wow. Well,
Sorry.
you are well. That's amazing because I have so many of these people that are low carb people, and I recommend it for health and for losing weight and so forth, and
Mm-hmm.
it worked really well for me. And like, I don't run around with bad breath. I'm very vigilant about just coming across as smelling well and appearing well. But I know it's an issue with a lot of people, and it's got to be dealt with. It just never occurred to me that it could be diet that's doing that, and not just garlic. It's the low carb thing. Holy
Mm-hmm.
cow. Okay.
Yeah. Yeah, the ketosis, sometimes it gives people the funk breath.
And no one ever talks about that, and I'm glad we did. I'm glad we did. Well, you are a wealth of knowledge, and you have a resource, an
I do.
e-course on dental hygiene, teeth. Uh, Tell us about it.
Yes. Well, I'm a dental hygienist and I work. And then in mid-March with the coronavirus, I'm in the state of California and they shut everything down. Dental offices, hair salons, all that stuff. So I was home for 3 months, and after I realized that it wasn't going to be over anytime soon and I needed to do something productive, I thought, well, I'm used to talking to people about their oral health and I love doing it. And so I thought this was a way I could offer that assistance to people, because everybody needs guidance in this. And so I did write an e-course, and it's all about oral health, taking care of your teeth and gums at home, what kind of things you can do on your own versus what you really need to go to a dentist or a hygienist to have done. And it's available. I'm raising the price in mid-September, so I'll include the link, but you want to jump on it soon, because after September 13th, the price is going to go up a little bit.
Okay.
Yep. And
I will
I'm,
put that link.
yes,
I'm going to put the link down below, definitely.
thank you. And I'm really excited to have the opportunity to talk to you today. I was just reading an article in one of my professional journals that studies show that having bad teeth not only hinders you in terms of just being sociable and having friends, but it hinders you with your romantic prospects, and it can hinder your professional growth.
Mm-hmm.
You're more likely to get passed over for promotion or not make the sale. And so
Yeah.
having healthy teeth and gums, it's good for your overall health, and it's great for your confidence. And
Yeah.
the better you take care of your teeth, the less you're going to have to spend to fix them in the long run. And everyone knows dental work is just ridiculously expensive. It just is. Even if you have insurance, it costs a lot.
Yeah. Yeah. There's no downside to taking care of your teeth.
Absolutely. Absolutely. Well, thank you so much for having me. Did you have any other questions for me?
No, that's really it. I think that people should just go and check out the e-course. I think that's, what a small investment that is compared to fixing teeth later on. I just think it's better to have this knowledge now, and I can't wait to get through it. It's pretty awesome. Thank you.
Oh gosh, thank you so much. It's been a real pleasure.